Good day, it's Steve Anderson, and welcome to the Crown Council Mentor of the Month program. I'm very excited today to introduce and have as our mentor Dr. Lorin Berland, who is a legend in dentistry, especially in cosmetic dentistry. For those of you that have heard me around the country at dental meetings, I have spoken of Dr. Berland frequently. You may or may not know that, Lorin.
No, I don't.
Yeah, so just as a little bit of background, Dr. Berland is an internationally acclaimed cosmetic dentist and one of the most published authors on clinical dentistry with well over 100 articles, and his best-selling Lorin Library Smile guide, as well as instructional videos. He has made a lasting impression on dental education. One of his great credits, and Lorin, I've got a question about this. Dr. Berland was the first fellow of the American Academy of Cosmetic Dentistry. He is included in the top 100 CE leaders for 19 consecutive years in dentistry and has been recognized by the AACD for outstanding contributions to the arts and science of cosmetic dentistry. His unique approach to dentistry has been featured in major national print and TV, and we'll talk about that today, including the news magazine 2020, which everyone's familiar with, Time, Town and Country, Reader's Digest, and GQ. Dr. Berland began his career as a denture technician, and after more than 35 years of listening and working with patients, he founded Dr. B Dental Solutions, with a full line of products specifically designed to treat the common yet serious issues affecting the daily lives of people with oral appliances, oral infections, and dry mouth, which are not addressed by major brands. And we'll talk about that today as well. So Dr. Berland, welcome, and thanks for being our Crown Council Mentor of the Month today.
Thanks so much for having me.
All right, so here's my first question. Little off script here. Here's my first question. If you were the first fellow of the American Academy of Cosmetic Dentistry, who was the judge? If you were the first one to ever do it, who was the one who decided to give you the stamp of approval? I got to hear this.
Well, yeah, the AACD started in 1984, and then in 1985 they started an accreditation process. And by 1992, they wanted to take it one step further. So they had a board of the people that were already accredited and the founding, well, in those days, they were all founding fathers. There were no founding mothers of the AACD back then. And I think there was a group of testers, whatever, and you had to do like 50 cases and document them and got tested. And the important thing is I did it before it got too hard. I made sure when I heard they were going to do a fellowship, I said, this is only going to get a lot harder. And I already documented everything I did. So I said, it's time to do it. And I was the first one to do it.
Very good. Well, you'll remember my late mentor and business partner, Walter Haley, always used to say that it's better to be first than it's better to be better. And
it's so true.
You've done both. You are first and done better in many regards. So everybody,
it's better to be lucky than to be smart.
So everybody has a story. Maybe we could start by just giving us a little bit of background about your dental history and what got you started.
Well, my teeth are pretty bad. And that, I guess I inherited this because I come from a family of really bad teeth. So, dentistry was always a subject, a family subject. All my grandparents, they all had dentures. My parents had bad teeth. My grandmother, one grandmother, she had a couple of teeth left and she had a partial denture. And she used to corner me, and she'd pull out her partial denture and show me her teeth. And she'd say, Lorin, if you were a dentist, I'd have all my teeth. Wow. So I grew up thinking, dentistry it's a big part of life. So when I was in high school, I got a job part-time working in a dental laboratory. And that evolved later on, I ended up working in a dental practice that really focused on cosmetic dentures. And that's where I really got into dentistry, and I really learned a lot. I just couldn't believe the changes that my dentist was doing every day for these people. I mean, they come in, they've got no teeth. Dentures were really the first cosmetic dentistry. I mean, when you think about it, you're not doing full mouth reconstruction, you're doing full mouth facial reconstruction.
Right.
So, that always stayed with me. And then I decided I wanted to go to dental school. And I'm really thankful for that background I got in dentures, because that stayed with me my whole life. I love dentures, and I love denture patients.
Well, you've had, and you continue to have an amazing career in dentistry. Can we go back a few years? I hold this as one of the great milestones, one of the great moments in dentistry was your segment on 2020 years ago. And I'll never forget watching that. In my recollection, it was one of the few positive stories that 2020 has ever done on anything. They're typically known for doing exposés and scandals. And so when I heard that you were going to be on 2020 originally, I thought, oh boy, Lorin's setting himself up for disaster on this one, because they never do anything positive. And it was a 100% positive story. So maybe just as a little bit of background, you could just tell us about your 2020 experience, because I think it's good media training, I think, just for everybody, but I think the story's fascinating, what you learned from that.
Well, what happened was I was publishing a bunch of articles at the time, and I did one article called "Baby Boomers Make Cosmetic Dentistry Boom." And 20 years ago, that was like the beginning of the whole cosmetic dentistry revolution. It was hot news at the time.
Right.
And 2020, they decided they were going to do a feature on cosmetic dentistry. And so they saw that article, it caught their interest, and they decided they just call me up and get my insight. And I thought they were joking at first, but I tried to be very, very helpful. I mean, I always tried. If anybody calls me, I always return every call, any email, and especially 2020 calls. You got to answer.
Right.
So I didn't know what was going to happen. Fortunately, I didn't watch a lot of 2020, so I wasn't really nervous. I didn't know that they generally screw somebody on there. And actually, in that segment, they did screw some dentists, but not me and not cosmetic dentistry. They made a big deal about how great it is. And anyway, they just kept calling me and getting my opinions of things. I just tried to be very, very helpful. But I thought I was doing good for the profession. I certainly didn't think they were ever going to do a segment on me. And it went on for several months. And finally, they just said, hey, we're going to do this. We got a green light, and we'd like to come down and focus on you. But you're going to have to close your office for 3 to 5 days. And I don't think she even got to 5 days when I said, I'll do it. And then after I did it, I started watching 2020. I said, oh my God, what did I get myself into? And that was when I realized they probably picked me because everybody else they asked turned them down. So, but anyway, I did it, and it was funny because the week before it was going to air, the ADA sent a mass email to every dentist that they had emails. There weren't a lot of dentists with emails, and saying, look out, 2020 is doing a thing on cosmetic dentistry. And I'm reading this, I go, uh-oh, do they know something I don't know? Because I didn't see the final show. And anyway, it turned out great.
Yeah, it did. It was really very, in fact, I think it did. That was really kind of one of the very first international media stories on cosmetic dentistry. And it ignited, I think, that whole.
It was before Extreme Makeover and everything.
Yeah. So, I think one of the lessons learned there, just from your example, is, return calls, be nice, be helpful, be cautious.
Oh, yes.
But, I think
be accessible.
Yeah, and just by virtue of your trying to be helpful, you ended up doing a lot of good. So,
Well, that's what we do in dentistry. I mean, dentistry, it's a do-good profession, and it's a people business.
it is.
And you've got to be a people person. You don't have to, if you're going to, you got to give if you're going to get. And like I said, when she called me, I really didn't know what was going to happen, but I wanted this segment, whatever it to be, I wanted it to be good. And, now with this new business, I'm circulating among dentists a lot more and business people a lot more. And what I've discovered is the more successful dentists are the most accessible dentists and the most polite dentists. They do, as you said, they return calls, they return emails. They're just nice people, and they know that golden rule, Barney. Please and thank you are the magic words.
You got it. All right. So I'm a big believer, and everybody that's listening knows this. I think there's a natural law that was promoted originally, I think, by Napoleon Hill in Think and Grow Rich, that basically says that the seed of greatness many times is found in the middle of adversity, that out of every adversity, there is the seed of something equal or greater. And you're a great example of that. You had a very serious accident just a few years ago that changed your course in dentistry and is leading on to some great stuff. So maybe you could tell us a little bit about that change of course, what brought it on, and where you are today.
Well, as you can tell, as I've said, I really have been obsessed with dentures and denture patients for my whole career. So for the last 20 years, I've been working on my own, trying to develop a bunch of products to meet the needs of denture wearers and basically everybody who wears an oral appliance. And now there's an oral appliance for everybody. Right. And because nothing has really changed in that arena in like 50 years. So I've been working on it in obscurity, so to speak. And I would test out products with my patients, with my friends' patients, with laboratories. And finally, we got to the point where the products really worked and the patients loved it. So I got FDA approval on 3 of the products and ADA seal of approvals. That's really important because that's a whole other level after the FDA approval. About 3 years ago, I got all of these seals and clearances. But I didn't know what I was going to do with it because I was too busy fixing teeth. I mean, I'd go to work every day and my schedule was full. And I kept saying, one of these days, I'm going to have to do something about it. Well, one of those days happened. I was riding my bike every day. I'd ride a bike like 5 miles before work. And I don't know what happened, actually. I hit a pothole or something. But next thing I know, I'm flying over the handlebars, and I ended up breaking my hand in 7 places, herniated 2 discs, and I had to get a new knee as a result of the accident. So, I was turning 60. I knew I was never going to be able to practice at the same level. I wasn't even going to be able to practice for a long time. Right. So, I said, well, this is one of those days. The time has come. So I was prepared. I had something else to fall back on and something that I was really excited about. So I put my practice for sale and I decided to start this new company, Dr. B Dental Solutions, and focus on getting these products out there.
So there you go.
There you go.
Now flip over the handlebars and you're in a new business.
I'm there. Well, but yeah, it wasn't that sudden. It was 20 years of preparation.
Exactly. No, and that is, the old saying that luck is when preparation meets opportunity.
That's so true. That was the 2020 thing. Yeah. I was working. I was writing these articles. I was seeing patients, but I never knew, it was going to get the eye of 2020. You just got to keep working, and hopefully opportunity will find you, as you said, and you'll be ready.
All right, let's talk about prosthodontics for a minute. I think you would probably agree that for much of your dental practice career, prosthodontics was kind of a, I don't know what you'd say, a throwaway specialty. Nobody kind of paid that much attention. It was all about cosmetics and the whole deal. Prosthodontics now is ahead of the class with the, you know, the all-on-4 and implant secured dentures and all that stuff. It is now at the forefront. Tell us what you learned doing prosthodontics that led to what you're doing now. Because when you explained this to me originally, I learned a lot that I guess maybe most dentists know, but from what you said, they don't, or at least they don't educate their patients. So share with us a little bit about what prosthodontics taught you and how it led to what you're doing now.
Well, I'm not a prosthodontist, though I have fixed a lot of teeth and replaced a lot of missing teeth. Prosthodontics is loosely defined as the art and science of replacing missing teeth, whether it's one tooth or a full arch or a full mouth. And I certainly did plenty of those. Dentures, as I was saying, I mean, that was the beginning of cosmetic dentistry. I mean, all the movie stars in the 30s and 40s, they all had dentures. It was like mandatory.
Yeah.
And so when I started seeing what a difference dentures can make in people's lives, not just their health, not their appearance, their entire demeanor, their whole emotions, I just, fell in love with that. But the problem is now is that most denture patients, they don't go back to the dentist. They go to the drugstore. And there's phenomenal things going on right now in dentistry. You've got, as you said, the overdentures, the snap-on dentures on implants, the fixed full arch implant bridges, or the all-on-4s. I mean, there's a fantastic, the digital dentures, having spare dentures. That alone is fantastic, to be able to just press a button and have a spare denture with scanning and printing and milling. There's just a whole lot of stuff that's really exciting. But the denture patients out there, it's like once they get a denture, they're ignored. And I think that there's got to be a lot of follow-up. The denture patients, they're most at risk for oral cancer and systemic diseases. So they need to come back. They need to have checkups. They need to check the fit of their dentures or their overdentures. They need to be made aware of what's new to make their lives better, like overdentures. I mean, the average denture patient out there, or the average denture, is 15 to 20 years old. And we all know that denture should be replaced every 3 to 5 years. And we can do so much more for them. And, studies have shown that 85%, up to 85% of a denture, they're infected with Candida, strep, staph, actinomyces, and E. coli after just 6 months.
Wow.
These are things that nobody is telling these patients how they can take better care of themselves. They've got chronic infections. I was just talking to a dentist today, a very well-known dentist, who told me that his father died of complications of Candida and his denture.
Whoa.
I mean, and that's not the first one I heard. So, I mean, there's a lot of things that the public, especially the denture wearer in public, aren't aware of. And, that's what I wanted to do, is develop products for them. They all suffer from dry mouth. They have these chronic infections, So that I wanted to bring the denture wearer back to the dentist. I wanted to give them ADA approved products, and you brought up all-on-4. I really want to commend ClearChoice and the other corporate entities that are doing these fixed implant bridges, because they have really risen the bar. I don't think people would know anything about those procedures if it wasn't for their commercials and their marketing.
Exactly. Yeah, I have that discussion on a regular basis with people, that the amount of money that they have poured into advertising alone has just raised the awareness in the American public. And a lot of that, dentistry in general is the beneficiary of that. A lot of those
I agree.
patients will go back to their dentist and ask about those procedures as a result of that. So you brought up a lot of issues that many patients are not aware of in terms of their overall health and their restorative dentistry. And that's one of the things, obviously, that led you to develop the products you have. Will you just comment? One of the things I didn't know is, and I guess everybody knows this, but I didn't know that all of the over-the-counter products that are typically sold to take care of your teeth are not good for prosthetics. In fact, you shouldn't use them. Can you comment on that?
Well, that has to do with a lot of the do-it-yourself myths out there. But there's a reason for it, because there haven't been really good over-the-counter products before. Polydent, they just haven't improved anything. The cleansers, they deodorize, they say they kill odor-causing germs, but they don't really kill the serious pathogens that cause serious problems like oral thrush, pneumonia, and cardiopulmonary infections. I mean, those are serious problems. So, I came up with the Cleanodent liquid crystals to kill all those bacteria and fungi. The other thing is the denture adhesives out there, they really haven't worked since 2008 when they took out zinc, because they were all formulated to use zinc. And then when the problem with the zinc was they had to put so much adhesive in that the people ended up swallowing the zinc, and that wasn't good for them. And if you talk to any plumber, this is a little bit of an anecdote, but they will tell you that in a nursing home, they always have problems with their plumbing, not their internal plumbing too, but also the external plumbing, the toilets, because people swallow so much denture adhesive and it mucks up the plumbing.
Wow.
So anyway, they took out the zinc, and the denture adhesives have not worked as well ever since 2008. So I wanted to come up with a denture adhesive that worked well and also moisturized the mouth, because most denture wearers suffer from dry mouth. And also dry mouth negatively affects the retention of dentures.
Right.
Did I lose the train of thought?
So these are a lot of whole health related issues. Why don't dentists tell their patients more about all of these issues? I mean, is it this flying under the radar, or what's going on there?
Well, I don't think they've really known what was going on. There weren't really any options out there besides bringing them into the office and getting them cleaned. So that's why we're here. That's why, my job is to educate dentists and to educate the public. And that's going to be a big part of our upcoming social media campaign, to tell the public about their prosthetics and all their oral appliances, not just prosthetics, but night guards, retainers, aligners, and especially airway devices. Because what's the use of opening up the airway if they're going to suck in infected air? So I think the problem is there just has not been great products out there to take care of their appliances.
All right, so let's talk about the underlying premise of the solutions you've come up with. Let's talk about cleanliness for starters. You're aware that the biggest killer in hospitals is pneumonia.
Oh, yes.
And that in many hospitals now across the country, the number one line of defense that they have put in is requiring that patients brush their teeth within 20 minutes of going into the OR. Now, I suspect that your products are going to end up being the product of choice in ORs coming up here. But and obviously the reason is because if they're going to be intubated, and that tube's going to go through their mouth, and if the mouth's infected, then all that infection goes into their lungs.
Exactly.
And so medicine's finally put those two things together, and that's just the beginning of a lot of things. So why don't you walk us through specific problems and solutions that you've designed for everybody's education? I think it was when you first shared this with me, it was important. I learned a lot. As I've queried a lot of other dentists about this, this was news to them as well. So walk us down the path here of what you've done and the problems you've solved.
Well, the first product I came up with, which was the most glaring problem for my denture patients, was a denture adhesive. As I told you, once they took out the zinc, it just wasn't working. And even before the zinc, denture adhesive was a necessary evil. It was yucky, tasted terrible, dried out their mouth. It was just plain disgusting. So, my patients asked me, can't you do something better? So, we came up with a copolymer for retention. Then we added aloe vera, vitamins A, D, and E, and a different oil, corn oil actually. And that worked to moisturize the mouth. And they really loved that. Then the other problem is, even with the denture adhesive, is how to clean it off. This is incredible, but most people with dentures are not told to clean their gums and to clean their denture, mechanically clean them. So I came up with Clean-A-Dent paste, which is also used. It's a very, very low abrasive paste to clean the gums, and you could use it to clean the denture. Now, this is a real problem because right now, most people, they think they can use toothpaste to clean their dentures and also to clean their all-on-fours. It's a real problem that I saw on all-on-fours in my practice, is because if you're using that on acrylic, you're going to create pits, and they tend to stain more. And that's, somebody who's spending $25,000 an arch, they don't want stained teeth. So while I was developing the Clean-A-Dent paste, we were also seeing all-on-4 patients, and we also started giving it to them because my first couple cases, they started staining. And they ended up loving it too. And the good thing about this is it's got aloe vera, vitamins A, D, and E, and tea tree oil and coconut oil, and it feels great and tastes great. But that one, I got the FDA approval, which was very hard because nobody had ever gotten an approval for a product that cleans gums and prosthetics before. And then when we applied for the ADA seal of approval, they said, this is too crazy. Nobody's done this before. They said, you bring it out on the market for a year and then reapply. If we don't have any problems, we'll pass it. So we brought it out, and we just got the ADA seal of approval of that last summer, which was really terrific. And as I said, it's the only product out there to clean gums and to clean dentures and all-on-fours. And what's really cool about it is if you're looking for a low abrasive, no fluoride, moisturizing toothpaste, Clean-A-Dent paste is for you. It's got a very high pH, so it's anti-cariogenic. And, people like it. You don't have to be toothless to love Clean-A-Dent paste.
Is that the marketing slogan, Lorin? You don't have to be.
I think so. I like that.
I like it.
You don't have to be toothless to love Clean-A-Dent paste. I love that. And then, thank you, Steve. And then the last product we developed, though we have 3 more in develop that are going to come out in the next 3 months, was, as I was talking about those pathogens, the bacteria and the fungi that stick to the dentures and stick to the gums, I wanted to come up with a soap cleanser that kills them. So I didn't want to just deodorize. I didn't want to just remove stain. I didn't want to just remove debris. I wanted to kill the bacteria and fungi. So that's our Clean-A-Dent liquid crystals. And it comes in a big bottle, and we've got little travel sizes. And then it's a pump dispenser. And then we paired with this little sonic cleaner. Now, all our products have the ADA seal of approval. And, you know, Polydent and Fixodent, they don't have the ADA seal of approval. And that's, you know, that's a whole other step after FDA clearance. Right. It's another vetting process. I mean, you can't buy the ADA seal of approval. It's very tough to get.
All right, great innovations. And just out of curiosity, Lorin, and I'm sure everybody knows this, is there application to your products like your Cleanodent toothpaste for cosmetic dentistry, veneers, those kind of things, or is this situation different?
Well, not really. I mean, you could use the Cleanodent paste for, you know, people with teeth. As I said, you don't have to be toothless to love it, but there's no fluoride. And I am a dentist, and I am a member of the ADA, and I do recommend fluoride in toothpaste, unless there's, you know, reasons not to use it.
Right. Well, with the rise in the aging population, so as you know, we've got 10,000 people on average a day turning 65, and prosthetics are going to become more and more prevalent everywhere. Just as the population ages, a lot more of us. You've come up with some great solutions.
It's inevitable.
Yep. Let's go back to practice for just a minute. If you were, this is my favorite question that I like to ask very successful people. If you were starting all over today as a dentist, knowing what you know now, so taking all of the knowledge and wisdom that you've gained, and knowing where dentistry and the market is going, what would you do? What would you do? What would you recommend to other dentists as they move forward in their practice with all of your experience in tow?
Well, you know, technology is changing. And I mean, it's changing at a rapid pace, faster all the time. And it's changing the way we do things. But you know, some things really never change. Human nature never changes. And one thing about dentistry and all healthcare professions is that if you take care of your patients, they'll take care of you. And I think that's very important. So I'd like to give you 4 rules, 4 truisms that I found in my career. The first one is, and you've probably heard these before, but nobody really cares how much you know. They want to know how much you care. And don't miss any opportunity to show it to them. Because, you know, God is in the little things. It's in the details. Yeah. And I would never miss an opportunity to show people how much I care and appreciated them coming to see me and trusting me, because it's all about trust. The second thing is, it's a concept called lagniappe. I think it's a Cajun word.
I think so.
And I think so. And it means, you know, giving your customer, your patient, your client a little more than they ever expected. And, you know, that's really important. And then the third thing is, everybody that comes into your office, just imagine they've got a button on their forehead that says, I'm a VIP, treat me like one. You know, and I think that all these 3 truisms, they're all basically variations of the golden rule. Treat people like you'd want to be treated. I mean, we all want to be treated like VIPs. We all want people to, you know, put in the extra effort to make us feel special. And the 4th thing, you know, we all make mistakes. Nobody's perfect. So, you know, you've got to forgive yourself. And you've got to move on. But it's what you learn from your mistakes that really make the difference. Yeah. You know, don't just keep doing the same thing. Analyze. It's constantly analyze yourself and constantly try to improve. I mean, those are very important things. That's every day in every business, I think.
Have you analyzed bicycle license? Your accident?
You know, it just happened. It was meant to be.
It was
just meant to be.
Well, and my hat's off to turning adversity into a great opportunity. You're doing some great.
Well, thanks.
I love your attitude. All right, talk to me about where everybody can find more information about your product line.
Well, they could come to our website, www.drbdentalsolutions.com. They can call us at 844-DR-B-DENT. And if you go to the website, we have a special portal now for doctors. Okay. And we'll have special discounts. And if any of the listeners out there, you're going to be at the annual meeting in Las Vegas next month, we'll be there and stop by the booth. We'll have tons of giveaways and specials. And I'd just like to meet everybody. And if there's something that we talked about and you want to talk about it more, I'll be there.
Beautiful. And we're definitely looking forward to having you there. You're going to be a huge resource for everyone. It's an honor to have you there. So again, the website is Dr. B, so DRB as in Berland, so drbdentalsolutions.com. You've provided some great education today, and I appreciate the wisdom and the insight, the lifetime's worth of work, and some great things that you're doing to make a difference in dentistry and patients as well. Lorin, thanks for being with us. And
thanks so much, Steve.
Look forward to seeing you shortly at the Crown Council annual event.
You too.
All right. Thanks so much. Have a super day.
Thanks so much. You too.